My name is Nicole Bruno, and here is my OCCI certification. And here is my driver's license. And for this task, I'm going to take a left lateral view of Arnie's shoulder. So first I'm going to place her in left lateral recumbency. I have my gown on and my thyroid shield, and I'm going to put my lead gloves on after I position her. So I'm just going to take off her leash. Going to gently position her. And I have this all set up here. So I have my marker, my left marker in the view. I'm just going to place my gloves on. And you want to extend their head so it's not in the view.
Hey, Arnie, you're a good girl.
Okay. So what I do to, can you just pass me a sandbag? So you can use a sandbag to keep her lower half mobilized and not moving. So I'm just going to position everything here. So I'm going to pull her opposite limb forward, like so, and her left limb this way. So when you take the view, you want to make sure you're in the center. The center beam is in the scapulohumeral joint. So we'll kind of rotate this way. Okay, and I have my marker in the view. Hey, Arnie. Hey, Arnie. Hey, Arnie. Hey, Arnie. Okay, go, go. Okay. And then I think we are all set to shoot. So Mary's going to go out. Okay. Let's just double check and make sure it's shot. And there's the view of our left shoulder. For this x-ray task, I am going to take a right lateral view of Emily's right femur. So first I'm going to place her in right lateral recumbency. Oops. That was my dosimeter badge. Alright, so first I'm going to position her, and then I'll put my gloves on. And I'm going to place a sandbag over her head to keep her stabilized. I have my marker in here. I'm just going to put my gloves on. So you want to make sure the head is extended, which it is. I'm going to collimate down because we don't need all of that in our view. I have my marker in here. I know. Okay. So Sarah's going to go out and take the shot now.
So, we ate ball last night, and then this morning, woke up at 2 a.m. to go outside.
Okay, let's see how that turned out. Okay, so there is our right femur. My name is Nicole Bruno, and today I'm going to be taking left lateral thorax x-ray. So Mary has already helped me position this patient in left lateral recumbency. I have tied his back legs so they are out of the way. I am holding his front legs now, and you don't want to hyperextend his neck because then that can affect your chest x-ray. So I have my lead gown on, my dosimeter badge. I'm just going to put my lead gloves on. Leanna's going to come help me put my other glove on. Thank you. Okay, so I've already measured the patient. We have a digital x-ray system, so it's all pretty straightforward here. So I'm just going to collimate, and you want to measure for the left thorax at the border of the scapula, and you want to make sure you get the TL spine in the shot. Your central beam should be at his 5th and 6th rib, which it is now. Table a little. I'm going to make sure his legs are pulled out of the way. I have my left marker in the picture. And now we're ready to take our shot. Mary's just going to shoot for us. And I always just make sure it pops up. And we're all set with our left lateral thorax. So for this task, I am going to take a right lateral view of Arnie's abdomen. So first I'm going to place her in right lateral recumbency. So I'm just going to take her like this. Good girl. Gently place her. So I have this set. We're set at 15 centimeters. I have my right marker, which I'm putting in to the view. So I'm just going to put this sandbag over her head. So you want to extend her out dorsally, and you want to pull her legs forward, and you want to pull her hind legs caudal. So you want to make sure the center beam is at her 13th rib. Just want to make sure you get the entire abdomen in the shot. Collimate. Once I have everything set, I'm just going to pop on my lead gloves. Okay. Okay, we are ready to shoot. And there's our right lateral view of our patient's abdomen. So for this task, we're going to take a lateral cervical spine x-ray. So I have my patient placed in right lateral recumbency. He's a little nervous, so we just have this muzzle on him just in case. So your landmarks want to be the base of your skull, or your patient's skull, and the edge of the scapula. So what I'm going to do is just position him like this. I have placed sandbags on his back end to keep him still. Hey bud, okay. So you want to extend the head like so. Hey bud. Okay. It's okay. 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 Good boy. So I'm just going to put my right marker in here as well. Just going to position like so. I have the setting set at 15 centimeters. Should be okay. Okay. So I'm just going to place my gloves on. And I have my thyroid shield, my gown on, and my dosimeter badge. Hey buddy, you're being a good boy. Place everything on me. Okay. Okay. So now this is set. Just going to extend his head laterally. I'm also going to place another sandbag here. Stay, buddy. To keep his legs out of the way. Like so. Okay, so I'm at the end of the scapula and the base of his skull right here. So I'm just going to grab my clicker here. So now once we have our patient positioned, we have our marker in, we're going to rev and shoot. we are all set with our lateral cervical spine. For this task, I'm going to take a VD view of Emily's pelvis. So again, I have my gown on, I have my gloves here, and I have my distributor badge. So first I'm going to put her in a VD position, like so. Good girl. I'm just going to put a sandbag on her. That way she can't get up. I know. I'm going to put my marker in the view. It's the right side. So I have my settings collimated on here. I'm just going to place my gloves on. First I'm going to position her, and then I'll have Sarah play with the gloves. So what you want to do is take her knees and rotate them inward, like so. And then Sarah's just going to put the gloves over my hand. That way I'm covered. You can just pull them across. Okay? So now I'm rotating inward. You want to make sure the stifles are in there, which they are. And Sarah's going to go out and take a shot. For this task, I'm going to take dental reps on this patient here. So I'm going to take 2 x-rays today. So my first x-ray is going to be the upper incisors. I have my plate here. So you want to stick the incisors right on the plate. I also use gauze to help position. Sometimes the plate slides. Okay, so now I'm going to take my machine, and you want to keep it at a bisecting angle like so. And you want to make sure you get the crowns and the roots in your x-ray. So here's my control here. So our control is already preset. You can also bump up the exposure down here if it comes out too light. So I clicked incisors here, small mouth. So I'm just going to step away. And I'm going to hold and shoot. And it pops up on our computer over here, and just check to make sure it's good. Okay, so my next x-ray is going to be of my right canine. So now when you take the canine x-ray, you want to make sure the plate is touching both canines. They want I'm going to talk with them afterwards. They want it. This is Rocky Burke, right? So I want to make it at an angle like so. And right now I'm just trying to get the right canine. I have my plate facing this way, touching both canines. You can also position the patient in a lateral position to take it. Now I'm going to shoot like so. And now I have it set on my dialer. I'm going to step back and shoot my rat. So I make sure it pops up. And now we're all set with our 2 x-rays. So for this task, I am going to be performing an alternative GI contrast study on this corgi stuffed animal here. So first I'm just going to explain a little bit about the GI contrast study, and then I will actually go ahead with the procedure. So for a barium series, which I will be simulating on this stuffed animal, this procedure would be for any patient that comes in that's severe vomiting, diarrhea, possible foreign body, any abdominal trauma. The point of this series is so that the doctor can see what's actually going on inside the patient's abdomen. So the contrast is given, and they can see where it either stops, where it's blocked. They want to see how it moves through the intestinal tract. If there's a foreign body, you can actually sometimes see the barium going around it. So that's very important for diagnosing. So some contraindications of the study would be a distended esophagus or stomach. So a distended esophagus would be a contraindication, because if we're placing this orogastric tube in or through the esophagus, what can happen is if it's distended, the patient can actually aspirate on the barium because it's not a snug fit. Also a distended abdomen, anything like that. Ileus would also be a contraindication. So first I have all my supplies here. I have my stuffed animal. I have made a slit in the mouth. This is my plastic bag. And I have also made a slit in the abdomen to take out all the stuffing. I have my actual barium. I have my orogastric tube. I have lube, syringe to administer barium. This is my tape that I'm going to use as a mouth gag to keep the mouth open. And then I have other tape to mark how far the tube should go in. So first what I'm going to do is measure my tube. You want to measure it to the last rib. So again, this is a stuffed animal, so I'm just going to kind of estimate here. But last rib should be about, straighten out the tube. Last rib should be about here. Okay. Right about there. So I'm just going to mark it where it comes out of the mouth so that I know how far to place the tube in. So use some tape right here. Perfect. I'm just going to double check that. Okay. Okay. So before I start my procedure, I'm first going to take a scalp lateral on the patient. So I have my patient here. No barium has been given to the patient yet. So first I'm going to take my scalp lateral on the patient, meaning that I am taking an x-ray on the patient before anything has been given. So this is a good way to see what's going on, and this is a good way to see if the patient actually needs barium or not. So I have my setting set here. This is the abdomen. I have it set to 10 centimeters. I'm just going to collimate here. So I get the abdomen. Okay. So now I'm actually going to step out to take this x-ray since the patient does not need to be held. I have all my PPE attire on. I have my gloves here, my dosimeter badge, my thyroid shield, and my lead gown. Just going to put the right marker into my film here. Okay, so now I'm ready to go out and shoot my x-ray. Just going to step this back. Come here. Okay, so we're all set with our scalp lateral. So I've just taken my scalp lateral of my patient, so now I am ready to actually administer the barium to my patient. So the dose that we use for barium and the dose in our textbook for a medium-sized dog is 5 to 8 mLs of barium per kilogram. So if this is a 20-pound dog, I just have my calculator, I'm going to do the math here. 20-pound dog is about 9 kilograms. So let's just say we're just the lower end, 5 mLs of barium, so that would be 45 mLs of barium to this patient. Okay, so first what you want to do is, I have my tube ready. I'm going to put my mouth gag in my patient. This is just my bag here. Okay, so there's my mouth gag in my patient. Okay. Not saying it very well, but there is that. So before you put the tube in, there are some things to know. You definitely want to make sure you're into the esophagus and not the trachea, because then you can aspirate your patient, which we don't want. So signs you could look for is when you're inserting it, you want to make sure the patient coughs. If you hear the patient cough, then you know you're in the esophagus, and that the trachea isn't affected. So I'm going to drop my 45 mLs of my barium. Give it a quick shake. Bottle here. Okay. Okay, so here is my 45 mLs right here. Okay, so now when you give it, you want to give it nice and slow. You don't want to really shove it in there, but you want to make sure you give it quick enough as to make sure that the barium doesn't start moving already, and then that could interfere with your x-rays. So after you give the barium, you want to take a radiograph at 15 minutes after giving the barium, half hour after giving the barium, and then 1 hour post-barium. So I'm going to give the barium now. So again, I have my tube already measured. So you want to first lubricate the tube to make sure that it easily goes and doesn't puncture anything. Whoop. You want to lubricate the right end of the tube, the tube that the side that you're placing into the patient. Okay. Just leave that there. So here's my mouth gag, right here. Okay. Now I'm going to place my tube. Now you want to make sure head's extended up. Okay. So I have placed the tube in the patient. I'm going to take the mouth gag out. So I have my landmarker here, and I have my tube in my patient's esophagus. So now I'm ready to give the barium. So I have my patient ready here. I am going to insert the barium through my tube here. So I'm going to start giving it. Let me move my hands so you can get a better look. Okay. So there's my barium. So now that it is given, we're going to wait 15 minutes, then we're going to take an x-ray, and then we're going to wait 30 minutes, then we're going to take an x-ray. Preferred views are lateral and BV at both 15, 30, and 1 hour. So before we take our x-rays, we of course want to take out the tube. So you want to slowly remove the tube, not to cause any pressure or damage to the patient. So the barium has been given, and we are now ready to take our lateral and BD shots, just to indicate on this patient that the barium was properly given. Again, so this is just a simulation. For an actual barium series on a live patient, like I said before, you would take a 15-minute, a 30-minute, and a 60-minute post-barium rad. So I'm just going to collimate here. Now with the with the abdomen, you want to make sure you collimate properly. So you want to make sure that you're at your diaphragm and in the center of the 13th rib. Okay, so I'm just going to come out and shoot. Just back this up here so I can take my shot. Okay, so there is our our lateral. So we are now ready to take our VD image of the patient. So I have placed the patient in ventrodorsal recumbency on his back. And I'm going to collimate, and I want to make sure I get my marker in here. So this is the right side. Okay. I'm going to make sure the patient's straight. You can also use sandbags on the patient if needed. And then we're going to go out and take our x-ray. Again, you want to center at the 13th rib. Okay, always make sure it pops up. And there it is up there. So we are all set with our simulation.